Even young men can die of a heart attack. Today I sit down with Dr. Amin Mirhadi, and he talks about the one test that can help save your life. So, Amin, tell me about your Heartquake story.
So I'm 51 years old, not the healthiest, but I'm not the unhealthiest in the world. I don't exercise too much. I used to, exercise a little bit more. Weight's okay, kind of lost a little bit of weight in the last, couple years or so. But I work at Cedars-Sinai Medical Center, and when you're a doctor, when you're on faculty, I've been there for 21 years now, it's kind of easy to get whatever test you want whenever you want it. I don't even have like a primary care doctor. I sort of function as like my own doctor, that saying about doctors being the worst patients. But, every now and then I'll just put some blood work for myself. And, starting about 15 years ago, I would occasionally get like a heart scan just to kind of see. It was so easy for me to get it. I would just order a test, and I started out getting these calcium tests, the CT calcium tests, which were easy. They would take 10 minutes. And then I remember about 3 years ago having a conversation with a friend of mine, wasn't even a cardiologist, but he said, you should get the CT coronary angiogram instead, which is essentially the same thing, but involves injection of iodine contrast. We'll pick up hard plaques, the older hard plaques, and these newer, kind of more aggressive and unstable soft plaques. So I had one 3 years ago, and it was zeros across the board. So I kind of was like, kind of cocky about it. I was like, oh yeah. And my wife would be like, you don't exercise, and I don't like your diet. I'm like, yeah, honey, but I'd always like point to that. Look at me, like, you feel like you have like a gold star or something like that hanging on your wall. And then, I had a friend who I went to medical school with, who was a really fit guy. I mean, as fit as you can imagine. And at age 46, a couple years ago, he died in his sleep of a massive heart attack from just coronary, atherosclerosis, coronary artery disease. So that spooked me a little bit. I'm like, maybe even though I've had this test that was normal, maybe I should just get another one. I kind of kept putting it off. And finally, I had a break between patients. I was free at 3 o'clock, and I had a 4 o'clock and a 5 o'clock patient. So I just sort of called the radiology department, and they're like, yeah, come over, we'll just scan you really quick. They do the scan, and I'm about to rush and get off the table to go see my patient, and the radiologist who was interpreter comes in and is like, no, wait, you're not going anywhere. Do not get off the table. I'm like, well, why? No chest pain, no symptoms, nothing whatsoever. Although I hadn't really been exercising to tell I was having, exertional problems. And he takes me back to his room and says, look, you have 99% blockage, or 90 to 99% blockage in your LAD. Now, coronary arteries, there's the left one, there's the right one. The left one is much more important because it irrigates with blood more of your heart than the right side. So mine was in a really bad spot, but it was also like completely obstructed. And the interesting part is it was soft plaque. So soft plaque would not have shown up on a calcium test. I was listening to one of your podcasts coming over here. You were talking about, I think it was like Scott Swift, who had a stress test.
Yes.
A resting stress test.
So this was my big question for you, because everyone on the internet is trying to ask me, what am I supposed to do? What test am I supposed to get done? So tell us, what are we supposed to do?
It's a great question. So if I had had the calcium test, which I had before, it wasn't my friend who kind of said, oh, this other one's better. I would have missed it completely. Mine would have showed like a perfect, if I had done the calcium test, mine would have shown perfect. But I was maybe weeks away from having this plaque rupture and, maybe kill me. Like, it was in a really
This was in the Widowmaker, right?
It was not just in the Widowmaker, it was at the junction of the Widowmaker and the diagonal. And that would have been like double whammy. Okay. And it was, when they put the stent in, I had emergency stent placement that same night. They were like, oh, yeah, no, it's...
So they wouldn't let you see your two patients, right? They were like, you need to stop.
Stop. Okay. They sent me straight to the ER, and then they sent me straight to the cath lab. And that's another nice thing, about being at a place like that. And, for 21 years, they just were all hands on deck, and they just probably saved my life with how quickly they moved, and having the quality of doctors that came and did the stent, you know, it made me think, I kind of feel bad because you're like, not everyone has that kind of access.
Right.
I mean, you know, I have it because of where I work.
Exactly.
A lot of the people we know have access to it because of the resources and the connections they have. But what if I was just Johnny general population?
Exactly.
Like,
in the middle of nowhere. That's
Yeah.
my goal with all these videos is how can we reach people that are in the middle of America or the middle and they don't know what they're supposed to do. Tell us more about what procedures you think that people should do for early detection of heart disease.
So that, again, when general cardiologists and internists make recommendations, those recommendations are based on guidelines.
Right.
Guidelines, you know, are obviously, they mean well. There's only so many resources in the healthcare system. Right. They're not unlimited. Like for people like me and you know, we could probably get more tests than someone in the middle of Missouri that might have a limited number of tests. So answering that question, you have to be careful because not everyone can get the CT coronary angiogram.
Right.
But for someone like me, and the reason I was like, you know, when we were at a party and we were talking about this,
okay.
3 days after.
So maybe we can talk about maybe we can talk about this because we're sitting. This is the universe.
Yeah.
I also believe in synchronicities, which is like things don't just happen out of nowhere.
Yeah.
Like there is a reason. And I'm sitting there. We're at a friend's party. I'd never met you before.
No.
This is like a week ago.
Yeah.
And so here we are. The universe is bringing us together.
Yeah.
And I'm like, will you please do a video? And you're like, I don't know, but yes, like to help people. So you're an oncologist.
Yeah,
you're
I treat
a cancer specialist, like world renowned too, mind you, just because, thank you. And here you are now switching seats and you're becoming a patient. I actually had someone on one of the videos. He's a cardiologist and he said that people should not do any of these tests proactively. He's like, people, you are misinforming people, Amanda.
Yeah.
People should not do any of these tests proactively unless they have symptoms and you're misleading people.
Yeah.
But I have to tell you, and that's why I want to ask you, as a patient myself, as someone who's led a support group at UCLA for over a decade, that is not the case.
No, of course not.
Sitting in a patient's shoes rather than those guidelines, the glossy guidelines are a lot different. So now that you have transferred from the seat of being this world-renowned oncologist, you know, radiation oncologist, did I say it right?
Yeah.
Radiation oncologist.
Say that 3 times more.
Radiation oncologist to now sitting in the other chair with a gown on. And what can you tell an actual heart patient or someone who's struggling?
Common things happen commonly. So people who smoke, drink, have uncontrolled high blood pressure, you know, lifestyle factors, other things like that, they're going to be at risk in a common way. So the guidelines are generally appropriate in terms of making sure that, you know, it casts a wide net and makes sure people are doing the right things. But what a lot of people don't realize, and as a doctor, the ability for a patient to understand something relative to your understanding. Like, so for example, I treat a lot of breast cancer. And when I'm sitting there speaking to a patient, I do my best to bring it down, bring the information down to little sound bites, little bits of information that I know are relevant to them and their journey and what's good for them. And there's such a disparity in terms of what you tell them or what they hear on the internet or what their friend tells them or whatever, and what the actual reality is. The same is true for heart health. And you know, again, I was never a cardiologist, but having gone through this experience, I certainly learned quite a bit about it. And if there's one recurring theme, is that there is such a powerful genetic component. And I think that, yes, we have all these tests, and I'll just give you a quick breakdown of what the tests are. There's the calcium scan, which is a quick CT scan without dye. That picks up older hard plaques, and it's a good test, but it won't pick up more for like younger men like me. If there's an acute situation like I had, it would not pick that up. But a CT coronary angiogram, which is what I had, is like a step up from that one.
But that's something that I'm just going to interject because insurance does not cover that, right? Like
not in any. It depends. I mean, the insurance question is very loaded because there's, you know, some plans might, some don't. It depends what indications you have. If you had like atypical chest pain or some other variables, your internist or your cardiologist can probably get it covered, right?
Okay, well that's good to know.
Yeah. But they don't just order it willy-nilly and everyone for screening. because there's a slight risk, with having the iodine contrast.
Yes, people talk about that.
And, the part that I do know about is cardiologists in general, and not all of them, but some of them want, like the one that you were speaking about, they like to avoid having people do CT scans because of radiation. Well, that's one area I do know about because I'm a radiation oncologist. I use radiation to treat tumors, right? So I'm quite familiar with that aspect of it. And if there's one thing I want your audience to know is that I think that the concern about the radiation you get from a CT scan, I think that's overblown.
Okay, this is good to know because I'm like the type of person, just mind you, that doesn't like to even go through the scanners at the airport because of radiation. So in comparison to going through the scanner where they scan your body with an X-ray versus, let's say, the CT scan, what is the radiation difference?
Well, it's not just the quantity, it's the quality.
Okay.
Like it has to do with the energy of the radiation. So for example, the radiation I use to treat people is what's in it's called the megavoltage range. So it's like really, really intense, but it doesn't cause the kind of mutations because it doesn't, like at your skin, for example, doesn't cause melanoma because it doesn't deposit its energy at the skin. The sun is a much, much lower energy radiation. It's in the ultraviolet range, and that can be a little bit more risky in some circumstances because number one, it's covering a larger area, so it's making contact with more cells that can subsequently develop mutations and become cancerous. But that type of radiation, all of its energy gets deposited at the surface. And then that's where the mutations can occur, as opposed to the kind I use to treat cancer. And then CT scans are a little bit in the middle, right? So to answer your question, CT scans, if you're doing 5 CT scans a day for rest of your life, you're at a very high risk, of course. But doing like once a year or twice a year. I mean, my patients get CT scans every 3 months.
Because they have to double check.
Because they have
to.
And and the long story short on that is that I think the risk is overblown. And if I had sort of adopted that mentality, I don't want to get a CT scan, I probably wouldn't be here right now, just because I just ordered this test on my own, and I didn't have that fear. So I hear a lot of, again, talking about misinformation, and not misinformation, but just people's understandings of it. I don't think enough patients understand like the risk versus reward. I think that if you have certain risk factors, you should be aggressive in monitoring, getting the CT coronary angiogram, or getting the resting stress test that Scott Swift had that you were talking about. There was like a couple of large studies, one called a meta-analysis, which looks at all the studies together, suggested that the CT coronary angiogram was better, right? Well, so the best test to determine your degree of plaque in your heart is an invasive angiogram, right? Where they go through your arm or your groin and they look in there, they inject dye. That's the best, but not everyone, that's obviously operating.
But that's not the one you did, right? Because I was confused.
Yeah, I know that.
I get so confused because an angiogram, you hear typically, so you hear an angiogram, you are in the hospital, you have, you're putting the balloon in there, like it's the balloon, right? The angiogram to check like the arteries. You right there is someone in the world of heart health, have your own podcast. The fact that it confused you, what does that tell you about the general population? Exactly.
Let me give the simple answer to that. Whenever you see, CT coronary angiogram, it's a CT scan, it's non-invasive. It's invasive in the sense that you get a little bit of dye, right? An angiogram is invasive. They just generally call that angiogram. That's where they go through your arm or your groin and they run a wire into your heart and they inject little bits of dye and they look at an X-ray to kind of see your heart anatomy. That's an angiogram. The treatment of blockage is an angioplasty. So CT angiogram that's invasive, and then angioplasty, putting the stent.
Yes, and typically when they're doing the angiogram, they will put the stent at the same time sometimes, right?
Yeah, so they're doing the angiogram in a diagnostic fashion. But if they see blockage like they did they already knew about mine, then they do a stent placement. Isn't that it's crazy. It's so confusing.
It's so confusing. I appreciate that because this is my issue that I face with people online or whatever. It's like you're just a patient advocate, and I am. I'm just a patient advocate, but I'm curious. Like I'm constantly trying to learn, and I learn from my patients and my support group, and just through my own experience. So I'm so grateful that you're sitting next to me because we have had, unfortunately, a lot of deaths in the community. We were in a similar community of younger dads, like men dropping dead of heart disease.
Absolutely.
So I want you to know, and I do have like friends of mine be like, okay, I want my husband to get checked out. Like, what should he do?
I am a big proponent of that, the CT coronary angiogram.
Okay.
For me, you know, even some people, because I've probably, ever since what happened to me, I've probably written the test like 40 times for people. They'll just go pay cash for it. Like a lot of people just, they don't care. You know, you can go to places where they charge like, whatever, $500 or something. Or some of them will have indications where the insurance will cover it. But
well, so it's $500 is the max payment? Okay, because that's because I know that they were saying like
in some places.
Some places it could be $500, maybe they can get the insurance covered. Okay.
Yeah.
So you are recommending right now is
CT coronary angiogram. Absolutely.
CT coronary angiogram.
I think for men in their 50s and 60s, I don't know what. So
do we start late 40s though?
And
I know family history is everything, right? Do you have a family history of heart disease then?
My dad did have a stent placed, and he's been fine.
How old was he?
He was like 70.
Oh, so he was older. So,
yeah, a little bit older, and he's 83. He's doing fine. The genetic part, I think, is really it's not talked about enough.
I agree. Yeah.
There are, you know, and I don't want to confuse your audience, but there are certain drug tests above and beyond cholesterol and LDL, things like lipoprotein A.
Well, we talk about that. So this
B.
is the issue. So we have lipoprotein A. We've got So and because I've had cardiologists tell me that these are the tests for people to do. What was the second one? Because I know lipoprotein
apolipoprotein B, which could be
apolipoprotein B. Okay.
And the simplest way to think about it is, there's two elements of causing plaques in heart disease. One of them is damage to your endothelial lining. You know, your coronary arteries have three layers. There's the intima, media, and adventitia, right? The intima, which is the part that touches your blood, that can get damaged by things like, you know, high blood pressure, spikes in insulin and glucose can damage. There's a little foam layer around that called the glycocalyx. That gets damaged with people that are diabetics and whatever. Once you cause that damage, that opens the door for all the lipoproteins to settle in there. Okay. So certain types of lipoproteins, like the lower density ones, are more likely to get in there and build up and form a plaque, right? Ones like the bigger ones that are more densely packed, the HDL, the high density ones, they don't go in as much. Okay. So a lot of the drugs try to reduce the smaller lipoprotein particles, but there are some people that have like lipoprotein A, large amounts of lipoprotein A, that no matter how much Crestor and Repatha and other drugs you do, it's sticky. It finds its way into the little nicks. So they'll be doing, people like that have like high values of lipoprotein A will be doing fine, will be doing fine, and then all of a sudden in their 50s, you know, men in particular, are keeling over from heart attacks because they didn't understand.
So you think it's because of the lipoprotein A? Because I tell people they have to get that test, but the problem is, like you said, the medications aren't there right now, too.
I mean, and everything is relative. You know, with LDL, it's a numbers game. One of my friends who's a cardiologist told me, if you can get your LDL below 70, you know, either through diet or a combination of medication, it's virtually impossible to form plaque. It's like very, very difficult if you go below like 70 or 50, I don't remember the exact number, but you can overcome genetics with medication, with lifestyle, with exercise. Exercise will increase the quality and integrity of your coronary arteries. But the point I want to make about the lipoprotein is, you know, even I'm a physician, and for me it's sort of like, what? Like it's mind-boggling, and even as much research I've done, I don't quite have a grasp on it. But I do wish there was more conversation from cardiologists and experts who are like, hey, there's a certain gene that will predispose you to having high amounts of LPA, lipoprotein A.
Because I have high amounts. Like I finally got tested and I have it. So, and it's interesting, and especially with women also getting that tested when you go on hormone therapy or anything like that. So any advice for someone listening or watching this as to how they can prevent it going this far? I mean, you said you were when I overheard you at the party, I like snuck in because you're like, you were 99% blocked in a Widowmaker. And that's a huge deal. And you said you were only given, you waited a couple more days.
Because it was a soft plaque, the soft plaques are generally unstable. Like the hard plaques, you know, the older ones that, you know, men in their 70s or whatever get, tend to be a little bit more stable. Mine was considered an unstable plaque.
Okay.
So everyone I had spoken to, the reason they wanted to do the procedure the same night is like, it's like a little rubber band, like a little elastic layer holding that plaque in. And any spike in blood pressure, walking up a flight of stairs or exercising or something, jumping up and down, it could cause that to plaque, and then all those lipids then go into the LAD and just block off, they clot off. And so yeah, mine was very, very lucky and very fortuitous. So I'm very grateful that I just randomly did a test on myself.
Right.
And I keep thinking about people who don't have that ability. If there's one bit of advice I can give is be your own advocate. As a patient, be your own advocate. Doctors are obviously, doctors, nurses, health practitioners, they're doing the best they can to try to guide you. But a lot of times the guidance is based on population as a whole. You're not going to recommend every test for everybody, right? And I'm not saying you should get every test for everybody. I'm saying as a patient, learn more about things like your apolipoprotein B, whether you have inflammation as manifest by elevated sedimentation rate, things like that. There are a lot of other variables that can influence your heart health. Stress, having a lot of processed foods, doing drugs, like a lot of things can cause those nicks and damage in your coronary arteries. So be your own advocate, try to understand these other risk factors and push for getting these tests accordingly.
Totally.
Yeah.
Well, and the other issue is for a lot of people, a $500 test is just out of the picture.
Oh, of course, yeah.
Out of the picture.
That's the
when you
scary
have
part.
to pay for your child's food or your food. And so what do you think for the people watching who are freaked out? You know, they watch the Taylor Swift video and they're like, okay, what are the tests that I have to get done that are affordable, that are economic, that can actually save my life? And I know becoming your own advocate. So you go into your annual appointment with the doctor or a cardiologist. What do you ask them? You just tell them about your family history. You ask them for, if they can't do that angiogram, is there anything similar that they can do?
Best way to start is understand your family history. If there's a lot of it, that will help you as a patient push for more aggressive testing. But less expensive testing that will give you an idea of what your risk is the blood work. But oftentimes a doctor might just get like a lipid panel where they look at your LDL, HDL, cholesterol. I don't think that tells the whole picture. For your audience, I would ask them to add LPA, lipoprotein A. Apolipoprotein B is another one. C-reactive protein, which is a marker for inflammation. Inflammation causes the damage to the coronary arteries.
So that's a third blood work test.
The third one,
3 blood work. Okay, lipoprotein A, keep going.
Yeah, apolipoprotein B, C-reactive protein. That's a very important one. It's the most important
I don't think
marker.
I've ever heard of that one.
Yeah,
so that's interesting.
It is a strong indicator of inflammation in your bloodstream.
Okay.
And also, there are a lot of things you can do. Whenever they say lifestyle and exercise, it sounds like your mom is nagging at you. That's not true. The lifestyle and exercise, the diet, and maintaining activity are by far the most important thing. Above all else, unless you have some really powerful genetic condition where you just cannot package lipoproteins as well as the normal person, lifestyle and exercise, diet and exercise will have the most profound impact. A lot of people don't realize that the most important protective mechanism for your coronary arteries is this thing called nitric oxidase. And if you have enough of that in your diet through arugula, through beets, through leafy green vegetables, that is the most protective thing I think you can do from what I've spoken to, And then exercise maintains a smooth blood flow across maintains the health of your coronary, of your arteries in general.
If you've got someone listening to this whose husband is so reluctant, hesitant, and like, I don't have time for this. I'm fine, honey. What can you tell them? Yeah,
no, it was kind of like me.
Yeah.
I was sort of like running around. I just kind of squeezed the test in, whatever. When it happened to me, a lot of people are like, "Oh, were you scared?" Or like, "Were you?" I was like, "No." It was really weird. Like, I was kind of like, I got to do what I need to do to help myself, of course. But I wasn't like, I was like, well, I lived a good life. Like, I wasn't like terrified or anything. But then, when I started seeing the impact it had on my wife, my kids, like my friends, all of a sudden, like I'm just getting a lot of phone calls from, people I know. When I started to see what it could do to make my family's world unravel, like not just from like the sense of being a provider, being a father, being a volleyball coach, but also just like little things like just not knowing, getting advice. My son going through high school, my daughter, not being there for them, it would have been very selfish on my part. You know what I'm saying? Like, and I think the best advice is, even though you might be like, oh, aloof about your longevity, it really impacts other people.
Yeah, that's beautiful. You got a stent put in on
Two,
Tuesday.
Yeah.
So you got 2 stents on Tuesday, and then you were at a party where I
On
met
Saturday.
you Saturday night. So it really didn't.
No.
I mean.
So what they do is the stents are easy. They go, nowadays they go, see, it's still a little shaved there.
Yeah.
You see a little scar there. They put a little wire through your radial artery. It goes up into your heart. And then they just thread through a little tiny stent that opens up when it gets there. Yeah. And then they do fluoroscopy to make sure it's in the right position. So sometimes they cannot, because I had so much obstruction, they were telling me before, I might not be able to get the stent through, so we might have to open you up and do bypass, which is what we were talking about earlier. Because my plaque was a soft plaque, it was very elastic. So even just that little, few percent opening, they were able to thread a little needle through and open it up and kind of put the stent in there. He was like, and it took him a while too, it wasn't easy. It's so funny though, because I have another friend of mine who's a doctor. Because of what happened to me, the next day I get home from the hospital, he's like, hey, maybe I should get this test too. I ordered it for him, there was a cancellation, he had the test the same day, and the same thing, go to the ER.
No way.
Yeah,
See,
same thing, go to the ER. Yeah.
Okay.
And he was a doctor too, yeah.
So what is Heartquake? What is this experience? So I call it Heartquake, trauma of the heart, because all the different lingo and words around heart disease. So what has this Heartquake experience taught you?
Not enough people like you who try to take the message from people like me or people like, who was just the other people that you've interviewed and simplify it into little sound bites that people can use and act upon. I think that there needs to be more of this. You have an audience. You have a built-in audience who listens to you, who trusts you, but you give very good information. And you do it from the lens of, I just want to make sure, to help somebody in the sense that maybe one bit of advice you give from one person you have on the show might lead to one test that might catch something.
Save a life.
Yeah.
That's the
goal. And you're doing that. And that's what's great about it. And I think that I wish there was more, as a doctor myself, patients get lost in your, I have doctors who will do 3-hour consultations and the patient will be sitting there like, huh? It's
overwhelming
and they don't even,
patient.
and they walk out of it without the important information.
Right.
So getting information in a way that's actionable, I think is the most important thing that your group, your entity can do. Yeah.
But what about you? I asked about what Heartquake has taught you.
Yeah. No, I mean,
thank you. But what has it taught you? What has this moment in time taught you about life? And could it be, I always ask people, like, could it be that your Heartquake was a gift? That this experience was a gift?
It was, again, being in the world, I treat people with cancer. Like when I had this condition, I had to cancel the rest of my clinic. I'm kind of like, well, they're sick too. I didn't want to, but my department was like, dude, go to the ER. Like, we got this, I've always lived by the notion that days are numbered. That you're only going to have so many days with your kids, with your friends. You're only going to go to so many parties. You're only going to go to so many games or whatever. Enjoy every moment, because you just don't know. It was very shocking to me that it was very realistic that had I just canceled that test, there was a chance I couldn't have been here. So it was like, wow, I might not be sitting here talking to you. I might not be going to, things I'm going to do later today, right? It's shocking to know how finite and limited life is. You have to just enjoy every moment.
So I coined the phrase Heartquake, which is trauma of the heart. What do you think of that word, Heartquake?
Well, I love it because we live in a world where there's a lot of processed foods, a lot of stress, a lot of drugs, a lot of viruses. People that we haven't even talked about the impact that COVID had on the heart, particularly on young men that had severe cases of COVID. There was probably some damage to the coronary arteries from that. You know, I had a severe case of COVID when I was younger. So Heartquake means, you know, your heart is the one thing above all else that keeps you alive, you know. And there's so many things that can damage it. So to me, and I was listening to a podcast the other day, there's 300 to 500 risk factors for heart disease. It's kind of, you'll go insane trying to address every single one of them. So what Heartquake means to me is, you know, everyone is coming at your heart. The whole environment, society is coming at it, and you have to protect it. And you have to take the steps to protect it.
Thanks for watching Heartquake Media. Make sure you check out our website and social media for more information on heart-healthy living. Wellness begins with your heart.